Welcome to Drug Class 101. Today we're going to be talking about Penicillin G, which is known as a narrow-spectrum antibiotic, which means that it's effective on a specific group of microorganisms. It's also considered bactericidal because it kills bacteria directly. This is Mallory. She's miserable because she hasn't been feeling well. She's been experiencing extreme fatigue, chills, coughing, sharp pain, decreased appetite, tachycardia, tachypnea, and is bringing up thick blood sputum. She just found out after going to the emerge and getting blood work completed and a chest x-ray that she has a severe case of bacterial pneumonia, so something known as Streptococcus pneumonia, a gram-positive bacteria. The doctor prescribes her Penicillin G for 10 days.
So, you're probably wondering, why would the doctor prescribe Penicillin G? Let's take it over to Alyssa, who's going to explain exactly why.
Now we're going to talk about the mechanism of action of Penicillin G. Here we have an illustration of the Streptococcus pneumoniae bacteria. Many bacteria have receptors known as penicillin binding protein, in which Penicillin G will bind to. Okay, so once binded with the receptor, Penicillin G will interfere with something known as peptidoglycan in the cell wall. Peptidoglycan is just basically a complex molecule made up of sugars and polypeptides, and it forms a tough chain around the bacteria. So peptidoglycan is a major component in bacteria cell walls. It basically keeps the bacteria strong, so it stays intact during osmotic pressure, which prevents the water and solutes from rushing into the bacteria. So Penicillin G prevents something known as cross-linking, which just is a fancy word for chains forming together in the last stage of cell synthesis, which is eventually going to cause the cell wall to lyse because it can't stand the osmotic pressure. But why aren't human cells affected, you may ask? Well, that's a great question. Turns out human cells don't have peptidoglycan in their cell walls because we don't have a cell wall.
This medication is prescribed for a course of 10 days, and since she's an adult greater than 60 pounds, she will be receiving an intramuscular injection of 600,000 to 1 million units a day. Teaching the patient or a family member to give the injection is an option. Otherwise, the patient can come to a clinic or have a home care nurse come to get it. Penicillin G should be continued for the desired course of therapy, even if symptoms subside and she is feeling better. This is because discontinuation could cause relapse or even a superinfection in the body with more serious health consequences.
Absorption is delayed depending on which muscle is selected for the IM injection. From the muscle, it is slowly absorbed into the muscle's capillaries. About 16% is protein-bound. It is widely distributed to most areas of the body, including lungs, muscle, bone, liver, kidneys, and will cross the placenta and enter breast milk. It's metabolized minimally in the liver and then travels to the kidneys to be excreted mostly unchanged by the urine. The renal clearance is extremely rapid, which is the result of glomerular filtration and active tubular transport. The urinary recovery is reported to be anywhere from 58 to 85% of the administered dose. Renal excretion of Penicillin G is delayed in premature infants, neonates, and in the elderly because of decreased renal function and should be used cautionally with careful monitoring.
Possible side effects include nausea, vomiting, diarrhea, abdominal pain or cramping, colitis, increased AST, ALT, lethargy, hallucinations, anxiety, depression, twitching, vaginitis, anemia, increased bleeding time, hypo or hyperkalemia, alkalosis, hypernatremia, local pain, tenderness, and fever with IM injection. Adverse effects include coma, seizures, decreased urine output, proteinuria, hematuria, renal tubular damage, bone marrow depression, hemolytic anemia, anaphylaxis, serum sickness, Stevens-Johnson syndrome, and pseudomembranous colitis.
Medication Penicillin G interacts with aspirin, as it will increase penicillin effects and decreases renal excretion. Penicillin also increases the effects of heparin and methotrexate. It is also important to note that it will decrease the effects of oral contraceptives, typhoid vaccine, and decreases antimicrobial effects of tetracyclines. It can also cause a false positive in urine glucose and urine protein. Another important point to mention about this medication is that it is contraindicated in those with hypersensitivities to penicillins and neonates. This precaution in those who are pregnant, as it is a category B, and those who are breastfeeding.
Penicillins involve carefully monitoring of the client's condition, as allergies are more prominent than with any other antibiotic class. Follow up with the patient to assess if there has been any previous drug reactions to penicillin prior to administration. Watch for signs and symptoms of anaphylaxis, including rash, itching, swelling of the throat, and wheezing. Discontinue use and notify your physician immediately if any of these symptoms occur. Keep epinephrine and resuscitation equipment close in case of an anaphylactic reaction. So, in addition to treating pneumonia, Penicillin G is also used to treat respiratory tract infections, scarlet fever, skin and soft tissue infections, gonorrhea, syphilis, and it also prevents rheumatic fever. It has now been over 10 days since Mallory first received her prescription for Penicillin G. After taking her injections for the course of 10 days, she now no longer has pneumonia and is back to enjoying life.